Right now we're moving into a different session, and we're looking at the role of development partners in supporting African innovation, ecosystem learning from the UNFPA Innovation Accelerator. And in this particular group, we have the likes of Davide Piga from UNFPA, he's a regional officer from there. And we also have Mbyallu, Sahara Ventures, and we also have Dorah, Index Slam, e-Shangazi, Karibu. And of course, we do have a very good moderator, Madam Felista, Bwana, Programs Manager from UNFPA Tanzania. Karibuni.
Good afternoon. Good afternoon. Yes, because I want to hear the voice from young people. They're always vibrant. So I'll be taking through what UNFPA has been doing in the area of innovation. And before, I would like my colleagues to introduce themselves. But I'm Felista, Bwana, have been introduced. I'm working with UNFPA Tanzania as program specialist for health systems, but also the lead on sexual and reproductive health. So, yeah.
And I'm Davide Piga, Innovation and Knowledge Management Specialist. I work also in UNFPA, but in the regional office for East and Southern Africa.
My name is Dorah. I represent Index Labs and e-Shangazi.
Yeah, thank you. So
Madam Mbyallu from Sahara Ventures. I'm Chief Strategist for Sahara Ventures. And I was lucky to run a project with UNFPA called AMOA.
Thank you so much. I almost forgot Adam. So UNFPA is one of the UN agencies working around thank you. UNFPA works around the issue of population and development, but particularly in the area of sexual reproductive health, particularly for young people. Data, especially use and collection and use, but also we work around addressing gender-based violence, including harmful practices. I think for those who have been in Tanzania this week, you have been able to participate or hear about the national dialogue around female genital mutilation, teenage pregnancy, early marriages. These are all part of these challenges around gender-based violence. So UNFPA is working in over 150 countries in the world. And in those countries, we understand that more than 80% of people live in those countries. In Tanzania, we have been here for over 40 years, since 1975, working with the government very closely to improve the sexual reproductive health, particularly for young people, but also to address some of the challenges such as maternal death. We understand that Tanzania is one of the 10 countries with a high burden of maternal death. And in Tanzania, 11,000 women are dying every year because of childbirth complications, and about 20% of the women who die are more contributed by teenage pregnancy. So you could see that young people have a contribution or have a big share in the area of sexual reproductive health. So if we can be able to find solutions that can help really to turn around the picture, to ensure that young people can access sexual and reproductive health, I think we'll be able to do more and good to our people. And also for the young people, we know that they are the big investment. We should put much effort on it. So I would like, of course, to allow my colleague to share why UNFPA, basically, we thought that doing business as usual in terms of programs is not going to help us meet the Sustainable Development Goals, aspirations, as well as the agenda for 2030. So we looked into what works and what can work well to improve our programs. So that's why we came with this idea of having the Innovation Accelerator, which we have worked with our colleagues, as Adam said, and you will hear more from Adam, but you will hear more from Davide on the whole concept, as well from Dorah, who is one of the beneficiaries. So I would like to welcome Davide.
Thank you. Hi, everybody. So let me tell you very briefly, because we only have about 15 minutes now left, what this Innovation Accelerator, the UNFPA Innovation Accelerator is, and what makes it stand out in a very crowded environment of initiatives aimed at promoting entrepreneurship. The UNFPA Innovation Accelerator was born in 2016 out of a simple yet complex challenge. How do we solve key pressing population challenges, particularly related to the SDGs and particularly to sexual and reproductive health, while creating job opportunities for young people? How can UNFPA, an organization that is passionately committed to delivering a world in which every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled, how can this organization empower young people to take charge in solving challenges that affect them and also help them make money and have a sustainable life? And the answer was quite simple. The answer was social entrepreneurship. Now, social entrepreneurship is a driver, a powerful driver of innovation, and it's basically about setting up a company that makes you money, but at the same time has a social impact. And there are so many initiatives out there that do this, that promote entrepreneurship, but how many of them focus on social entrepreneurship or social impact, and how many of them focus on health, healthcare, sexual and reproductive health? Not many. So, because at UNFPA we believe that health is a priority, is important, including when it comes to setting up a business, because if you don't take care of your health, you're not going to be able to run a successful life, not to mention a successful business. We stepped into the space and started partnering with business incubators from various countries, 4 countries in particular, for the time being. And we, one of them being Tanzania, the other Kenya, Rwanda, and Uganda. And we started asking young people, what is that perfect service or product that you would utilize yourself to be able to access information, quality information on sexual and reproductive health? And we received a lot of good ideas, amazing, brilliant ideas. We accelerated 19 of these ideas, and 19 of them became social enterprises. We have one of them here through Dorah. And I don't have the time to tell you about each one of them, and I also had some images, but we're going to skip them. You are free to reach out to me later to know more about the African 19 social enterprises. But let me just tell you that it's amazing what happens when you empower young people, when you trust them to deliver solutions to complex issues. These social enterprises do everything from artificial intelligence to answer your embarrassing questions on sexuality in a discreet way, anonymous, to comic books, to crowdsourced videos. There are many, many, many of them. So maybe let me let Adam talk about the specific context of how we did it in Tanzania. What do you think?
Thank you. First of all, I want to congratulate UNFPA for coming with these initiatives. We have been at the innovation and tech entrepreneurship ecosystem pressing the need of development sector to start adopting and embedding innovation concept in their programming to deliver for the maximum output of whatever they are delivering. And it is with this goal that where UNFPA come, and they did it very well. And we at Sahara Accelerator, at the point of, as a part of an accelerator, and speaking on behalf of African hubs and spaces across, is we as African hubs and spaces, we should start thinking how are we pressing or supporting these development actors to come up with such ideas and how they can be utilized, especially on social entrepreneurship, and help social entrepreneurship, scaling them, where possible, incubate them. So our role was really to come and collect these ideas and help them incubate them, mentor them, and help them to go to the market from the idea stage to the startup stage. And I might say we did quite commendable, at least for my stage. And we have a number of very good case stories on the ground. For example, we have got the likes of Mkwawa Arts, who came as an idea, but now they have an office in Iringa, delivering for the program. We are partnering with them to run another sexual reproductive health project in Iringa, supporting 100 young women out there, managing themselves. They have got quite another number of calls from other actors in Iringa region. For example, I hear that they are on talks with Marie Stopes to work with them as well. So thinking of how this is helping to accelerate the programming and delivery of the acting of really development issues, from the idea of one personnel to now other actors, even down to our countryside, working and spreading the word, especially on sexual and reproductive health. So taking example of these ideas, the likes of e-Shangazi and others have come up, and now they are business, employing other youth. I think it is key for the development sector to start adopting and really help push the social entrepreneurship to support and help the development goals. Thank you.
So much, Adam. I think that was good. Now, I think it will be good to hear from the beneficiary. So we hear from Dorah, from e-Shangazi. She'll be able to speak about who is that e-Shangazi, and then even what is happening after the demo day. Welcome.
Thank you. Like I introduced myself, my name is Dorah Peter, and I'm the project lead for e-Shangazi. E-Shangazi is basically like a personal assistant for sexual and reproductive health, and she's implemented on Facebook Messenger platform, and she's an AI-powered chatbot. And she came to life, as Madam said, on the demo day, that was last year in August, as a result of capacity building and mentorship from Sahara Ventures by using Sahara Accelerator, and we got a seed fund worth of 6,000 USDs from UNFPA Tanzanian office, and we are very thankful for that, because that helped to scale up our idea from the scratch to where we're actually running as a prototype, helping people in sexual and reproductive health. So e-Shangazi comes to the society targeting youth that are aged between 13 to 24. And we are targeting that particular group because during the acceleration, the theme was tackling teenage pregnancies. And that's the age group that is most affected by the teenage pregnancies. So that is our target group. And we are actually coming to the society to educate them on their social and reproductive health rights, effects of teenage pregnancies, the allocation of different service delivery points where they can actually go and get preventive and curative services in regard to sexual and reproductive health. We are also able to provide one-to-one referral, like if you have a personal query with a doctor, e-Shangazi can connect you to a doctor, and you'll be able to talk to the doctor as a one-to-one. So you can be solved, your challenge can be solved through that doctor online. So e-Shangazi is actually has evolved. I can say we have evolved in the course of 1 year, because as we started, I remember on the demo day last year, we had like 900 followers on Facebook, but as of current, we have 19,000 followers. So we believe we are making a change in the societies around us. And we actually have a lot of youth that are engaged. We have different users from Tanzania and outside of Tanzania, despite the fact that e-Shangazi is using Swahili. So we have seen a positive impact from the society, and for that we know we are actually making a difference as youth. And I would also like to thank the government of Tanzania for actually believing in youth and engaging them in different innovative ideas in support of the different ecosystem hubs in the country. I think that will be all. Yeah.
Thank you. Thank you. I think you would want to know probably what is the thinking beyond the Innovation Accelerator, which we call the AMUA. What is our plans as UNFPA and our partners? I will allow my colleague Davide to talk a little bit about it, and then we'll have a small video which will see how all the Innovation Accelerator, all the stories we are talking about went through. Yes, Davide.
Yes, thank you, Felista, and thank you, Dorah and Adam. And Dorah, the story is very amazing. This is one of many. 19 that we have accelerated is not that many, but You've seen, you take one social enterprise owned by one young person and you're already making a difference to many. Imagine the potential. And the vision for the future, as Felista mentioned, is that not only we help these young people to set up businesses that have a social impact, but at some point we start calling them beneficiaries, and we stop calling them beneficiaries and we start calling them partners. Because now they are able to deliver services, to deliver a public good. And we, as UNFPA, and Dorah mentioned the government, we should trust them to be able to deliver quality services. That's the end goal, to start partnering with these young people so that they can play a role, create a safe space for them to experiment innovative approaches, and then trust in them to deliver innovative products and services. That's the vision for UNFPA.
Thank you, Davide. And I think we have a few minutes. We show video, and then we can be able, if there's any question, we are happy to respond. But let's see the video.
I wanted to add something on e-Shangazi. Maybe some of you are actually wondering how we came up with the name. For the Tanzanians, they understand Shangazi means aunt. So e-Shangazi stands for electronic aunt. And we came up with this idea because most people confide in their aunties when they want to talk like sensitive issues. So we thought, why not bring an electronic aunt to the palm of their hands to actually ease the conversation between, about sexual and reproductive health. Because in our culture in Tanzania, people barely talk about sexual and reproductive health. So we thought, let's bring this into a device where they can actually privately talk with e-Shangazi matters regarding sexual and reproductive health. I wanted to clear that for some of you. Yeah, so if you have any questions, we are open for that.
Thank you. I think we have one or two questions after the video. Can we have the video?